In this episode of Making the Rounds, we're discussing advancing treatments transforming the way we address injuries and chronic conditions in orthopedic and sports medicine, Orthobiologics. To learn more about this topic or other orthopedic-related services provided at Banner Health, please visit bannerhealth.com/orthopedics. Making the Rounds dives into medical topics with those who know them best, healthcare providers. My name is Bridget, and I'll be your host for today's episode. If you're new to our podcast, thank you for tuning in. And if you're a regular listener, welcome back. Joining me today on Making the Rounds is Dr. Elizabeth Batterton, a non-operative sports medicine physician at Banner University Orthopedic and Sports Medicine Institute in Phoenix, Arizona. Thank you, Dr. Batterton, for joining me today on Making the Rounds.
Thank you for having me.
We're excited to talk about these amazing advancements that you bring here at Banner Health and Banner University Sports Medicine. Can you start us off, Dr. Batterton, and really share your journey with us on how you got into orthopedic sports medicine?
My journey kind of starts back when I was in college. I was a two-sport athlete in college, which means I had my fair share of injuries. So I got into medicine really so that I could help people heal from their injuries, whether it's a acute athlete injury or chronic overuse type injuries. But really my love for medicine and sports medicine started back in college. When I was doing my family medicine residency, we had the opportunity to work with a lot of sports teams, and that really solidified my love for musculoskeletal medicine. And so I decided to do a sports medicine fellowship. I did that in Texas, where, football is king, and we saw tons of different injuries. And I really got to hone in on my craft of, treating musculoskeletal injuries there. And then I was in practice in Texas for the last 9 years, doing a ton of different work with orthobiologics. And so that really grew my love for that.
I'm going to assume, but I want you to share with us, where did your interest really, where did you really gain an interest in orthobiologics?
I actually had a really wonderful mentor who came from the Steadman Hawkins Clinic in Colorado. They're at the forefront of a lot of research and up and coming things, especially orthobiologics. And he actually helped to develop what I now realize is kind of the future of orthopedics. And so I really got to learn from him about PRP and bone marrow, and then realizing the different treatment options that I was then able to provide to patients where they were able to avoid surgery was really probably the mainstay of why I wanted to pursue it more. But having a great mentorship that helped me learn that was really the reason I got interested in it.
We're sharing the phrases orthobiologics. You just said PRP, bone marrow. For our physicians or for our listeners that really don't have a true understanding of what this means, or they're new to this field, can you explain what orthobiologics, PRP, and how they're applied in orthopedics and in non-operative sports medicine?
So orthobiologics is now kind of this umbrella term that we have to kind of encompass all of those things together. A lot of people have probably heard regenerative medicine or stem cells and things like that. We try and get away from the word stem cells because really, when we think about stem cells, there's two different types. There's adult stem cells and then there's embryonic stem cells. A lot of what people think about when they think stem cells is really that embryonic stem cell that can develop into anything. Our adult stem cells aren't exactly like that, but those are the cells that we recruit for adult stem cells. So when we talk about orthobiologics, we're really talking about mesenchymal stem cells. PRP is platelet-rich plasma. There's other formulations under orthobiologics. We can talk about amniotic fluid. We can talk about adipose. All of those things have cells that we can use to treat different musculoskeletal injuries. But for our purposes here, we mainly stick to PRP and bone marrow aspirate concentrate.
Thank you for that overview. I think that's really helpful because like you had mentioned, a lot of us have heard regenerative medicine, and not really understanding what that entails. So as you're sharing that all right, we're moving away from this, this particular stigma of stem cell. That's not what we're referring to in today's conversation. And so when you're talking about, these are the specific ones that you use in orthopedic medicine, what types of injuries or conditions are best suited for the treatment utilizing these orthobiologics?
So I really kind of divide it into kind of two categories. One of them is going to be your muscle injury or tendon injuries. And then the other is going to be your kind of chronic arthritis type picture. And those are kind of the two different ones. So if you think about chronic tendon injuries or muscle injuries, we're talking about tennis elbow or Achilles tendonitis, plantar fasciitis, or even like a muscle tear. We can use some treatments for that. And then also our chronic overuse type injuries as well. So it doesn't have to be like an acute, you just went out and, got on the basketball court and tore your Achilles tendon type of injury. It can be your marathon runner and chronically over the last, 10 years, you've developed some inflammation in that Achilles tendon, and we have some other options for that. And then also our osteoarthritis is probably one of the most commonly studied things that we look at for use for our bone marrow aspirate and our PRP.
So when you're talking about which body part you treat with which particular biologics, like can you share with us a little bit about those clinical benefits and that differentiation? So when we're talking about how do those orthobiologics compare to some of those traditional treatments? Because these are non-surgical advancements that we're utilizing to treat these patients.
Yes. So I look at it as a spectrum of treatment. So you think about your traditional treatments that we would do, especially on the conservative side, where we would do your anti-inflammatories, Tylenol, physical therapy. You would add all these things to help treat these, musculoskeletal injuries. Now we also have injections that we can add. Most people, when they think about an injection, would be a corticosteroid injection, whether that's into a joint or a bursa. Now, for chronic tendons, we get to add on our other kind of treatment options. So, PRP is where we have that platelet rich plasma, which we can use to treat these chronic tendinopathies and not increase the risk of damage to the tendon. We still do all the conservative things first, but now we have another tool in our tool belt, if you will, to help heal these injuries and really kind of avoid surgery because a lot of these aren't treated successfully with surgery. It's kind of a last effort. So now we have something else we can add. So really, I think the biggest thing is how minimally invasive this is that we are not having a big major surgery. We're actually using your own body's healing response to augment your body's healing response to get you better faster. It still takes time for those healing factors to work, but for a lot of times, we're able to minimize that downtime and get people better faster.
Can orthobiologics be utilized in conjunction with surgery, either as a pre-therapy or a post-therapy?
Yes. So one of the things that I like to tell people is, once you go the surgery road, you can't really go back from it, but there's things that we can try beforehand. A lot of times, I kind of use the old dad joke, it's worth a shot. If we can try an injection and we get them, 80 to 90% better, amazing. If, we're happy with that. If it's something that they're like, I want to avoid surgery at all costs, we can try it, then I think it's worth going down that road. It can also be something that we add on at the time of surgery. So a lot of our surgeons will augment some of their rotator cuff repairs with PRP or even bone marrow. There's even some new studies where like for ACL repairs that we're able to do that at the time of surgery. And then even after surgery to help with recovery, we're able to add, PRP or bone marrow after surgery to help the healing process.
That is so amazing. Where do you anticipate these treatments evolving over the next decade or so? Just based on, you've been in medicine working with orthobiologics for over 10 years. Where do you see this evolution?
I mean, I really think being able to titrate and make an individualized treatment plan for each person and being able to dial that in for their healing, I think is going to be really important. I think that will be a huge advancement in the field of orthopedics. But I think moving forward, as the research improves, we'll be able to do more of those things to help move the field.
Walk us through that process. Or once you identify that a patient is a candidate for PRP or, any other orthobiologics that you feel they would be the best candidate for, walk us through that process. What does that entail?
So really, you come in, we decide you're a great candidate for it. So you would come in, you get your blood drawn the day of the procedure. I normally have people go and exercise for about 30 minutes before their procedure. It helps kind of get the blood flowing and improves your platelet yield. We draw anywhere from 60 cc's of blood to 180 cc's of blood. And then we have a centrifuge system that we kind of pump all that blood in. We get anywhere from 2 to 10 cc's of platelet-rich plasma back from that. So it's a lot of blood to get a little yield. And then at that same visit, we then inject that into, a joint or a tendon that we're treating.
And when you're saying 10 cc's, how many treatments does that equal? One?
Um, Normally I would say um, 2 to 3, depending. I always tell people PRP, it's an inflammatory response, so it can be sore and uncomfortable just because you are creating this pro-inflammatory response, but your body sometimes it'll still signal that, oh, this is uncomfortable. So normally I say 2 joints is about what people can handle. We start to talk about 3 joints, people kind of hate me.
Got it, got it. We know the reaction to cortisol steroid injections, little uncomfortable, a little sore. Is that kind of the same similar, I would say, procedure in the sense of injection-wise and how you guys are implementing it?
So I would say yes, very similar. So um, at Banner, especially in the sports medicine department, we do all of our injections under ultrasound guidance. So I would say that the pain and that uncomfortable feeling is going to be less because we're guiding our injection exactly where we need to be. With a cortisone injection, you have a little bit of lidocaine, so that numbs the pain for 4 to 6 hours, and then the steroid kicks in 2 to 3 days. So you might be a little sore and achy. But I will say with PRP or even bone marrow, you're creating this inflammatory response. So people can be, it's more like a deep ache, and it can be a few days to up to a week while those cells are being activated and starting the healing response. So you can be more uncomfortable. Not normally more so than you've already been, but sometimes, especially like for like a tennis elbow or even Achilles tendon or a quadricep tendon, sometimes those can be really uncomfortable.
Got it. It's so, like, mild activity until you're feeling better.
Exactly.
Can a patient go straight from, "Here's my pains and I wanna go into PRP," or do we start more conservative with, "Let's try some of the steroid injections first, see how you manage." How does that work?
It really kind of depends, patient to patient. Ideally, steroids have side effects. And so if we can avoid doing steroid injections and we can treat people with their own healing response, then I think that that's a great option, especially for our young, healthy population. I'd prefer to inject you with something that is your body's healing response, just kind of amplified, rather than just putting a band aid on it with a steroid. But we can kind of determine that based on how they respond, how they present, and what their priorities are. Some people are like, I don't want to do any steroid at all. That is not appealing to me. And then we have all these great opportunities to inject them with something else to help augment their own body's healing response.
If they're, for any of our listeners, either a physician or a patient, if there's anything that you would like to leave with them about orthobiologics and PRP, what's that message you'd like to share?
I mean, really, for physicians and patients alike, honestly, I think orthobiologics is the future of orthopedic medicine. And so I just want everyone to be aware that this is where the future of this field is going, and to be able to treat people, non-surgically and get them better and back to doing the things that they want to do and love with minimal downtime. I think that that's really important to know. For physicians, knowing that you're able to offer this to patients as something new, that doesn't involve a surgeon is also really great. Because I think a lot of people now want a more holistic approach. They don't necessarily want to have a surgery. And so this is a really great option to be able to have, to give to your patients. Say that, this is And like I said before, another tool in your tool belt to get people better.
Love that. Thank you. Thank you for being here.
Thank you for having me.
Thank you for joining us today. And if you found this conversation as informative as we did, please subscribe to our podcast for more discussions on important medical topics. To learn more about Dr. Batterton and the orthopedic services provided at Banner Health, please visit bannerhealth.com/orthopedics. Thank you for listening, and we'll see you next time on Making the Rounds.